Greetings from Delhi Medical Association and eMedi News. Welcome to the show Chat with Dr. KK. We have with us Dr. Anupam Sibal, a pediatric gastroenterologist who is the group director of the Apollo Group of Hospitals trans the world, I can say. Welcome to the show.
Thank you, KK.
We are now entering into the year 2013, 2013.
Yes.
We have over 14 years of liver transplants in pediatrics.
Yes.
What's new in 2013?
Well,
what's the message for my public and for the doctors?
Well, I think the first thing is that liver transplantation is very successful. You go back to leading a normal life. This child that we had transplanted in November 1998, who was 18 months old, is now 14 years post-transplant with normal liver function tests. He's in class 10, wants to grow up and become a doctor. The message is that if as a child you had a transplant, you go through development normally, puberty normally. One of the concerns that the community has is that with the girl child, when she go through puberty normally, will her fertility be normal? And these questions have been addressed. The other big question that doctors had, what about infections? How will we manage immunosuppression? And I think we've shown that over the years that it is easily possible. All it requires is a bit of coordination, some common sense and a system in place.
Normally we say in a kidney transplant average life is 7 years.
Yes.
But in a heart transplant, we know people are living for 30 years.
Yes.
And what about liver?
Most of the successful liver transplants in the West happened in the mid-80s, late 80s, early 90s. And they're doing absolutely fine. In fact, if we look at the longest data from a center in Japan, their 18-year survival is 80%. So, it is very successful when it works well. And if the first 3 months are good, then your life is pretty much normal.
If I have to name 4 or 5 conditions, you feel that a physician or a pediatrician or a GP should refer and should think of a liver transplant, what are those?
See, basically any child who has cirrhosis and is developing ascites, irrespective of the etiology.
So at what level?
The moment he develops ascites, if he has jaundice, he has a hard liver, he has ascites, that's the time to refer because there's decompensation. The albumin is low and if you do a prothrombin time, it will be prolonged. There are certain inborn errors of metabolism where it should be done very early because you can prevent damage to other organ systems. Of course, now the indications have increased and include conditions in which there is no liver failure. For example, hyperoxalosis where you can prevent kidney failure, hypercholesterolemia.
I'll go back because these are rare disorders. Yeah. Still the commonest is the cirrhosis of liver.
Cirrhosis of liver where you have ascites.
So that means a patient has a portal hypertension.
Yes.
And either varices or he has an ascites.
Yes.
That's the time to refer.
And he's got a hard liver. Yeah.
Obviously.
Absolutely.
And you do a biopsy, or if it is a biopsy case of cirrhosis of liver with ascites, you should go for liver transplant.
The other, of course, is acute liver failure, which is very, very important because we have the ability now to transplant someone within 12 hours of presentation, and that's crucial because the moment encephalopathy sets in, this patient really needs to be in an ICU and preferably in a center where liver transplantation can be offered because you can go from grade 2 encephalopathy to 3 to 4 very quickly.
Liver failure, what is the, am I looking for that?
We're looking for INR, we are not looking for any of the other
INR
clinicals.
only.
If the INR is more than 4, this child is going to need a liver transplant. If he's in grade 2 encephalopathy, he can very quickly go to grade 3, he will need electric ventilation and he can go in a matter of hours. His kidneys can go into hepatorenal syndrome, he can require ionotropic support, the cerebral edema can increase and then he might not be transplantable. So the key is INR of 4 and deteriorating level of consciousness refer.
I would take it out from my GPs, INR 4 is the main thing.
Yeah.
Now, coming away from liver, coming away from pediatrics, if you would not have been a doctor, what you would have been?
Maybe I would have followed you and be a media personality.
Okay, you would have been sitting here interviewing
you.
Okay, so this brutal gang rape has shaken the whole world.
Absolutely.
Your comments?
I think it's a very sad reflection on the state we find ourselves in. The fact that something like this could have happened really shakes the very foundation on which our society has been built.
Do you feel this change will convert into another big change?
I think it will. It will perhaps be a trigger for a lot of introspection. We pride ourselves in being a family-oriented society, in putting a girl, a lady on a pedestal, on having this reverence towards women, and that has been shaken. And when society starts to grapple with a fundamental that they have accepted changing, it triggers usually a change, and one would hope that this change will be positive.
Do you feel that the first on contact for a victim is the police. They should be well versed with first aid, cardiac first aid, and
I think it's a huge opportunity, and as you have been doing, training individuals, training school children, auto rickshaw drivers, taxi drivers, college students, anybody, fire brigade personnel, police in basic life support, because you never know when you might be able to save a life, and if you can save one life in your lifetime, isn't that amazing?
One very specific question. In your group of hospitals, first on contact is the chowkidar at the gate.
Right.
Because people come and he opens the gate for an emergency.
Yes.
Is he trained in CPR?
Every single employee in the Apollo Hospitals group, 65,000 is trained in basic life support, and all the nurses and the doctors, depending on their specialty, are trained in either ACLS or pediatric life support or neonatal life support.
So what Dr. Sibal says is very clear, that in a child, if there is a liver failure, acute liver failure, and if the INR is more than 4, or if there is a presence of cirrhosis, refer them for a possible liver transplant before it is too late. Let's thank our guest.
Thank you, KK. Thank you.
And that's all for today. We'll come back with one more show. Till that, goodbye. Thank you.